And at this point, I'm going to turn over the panels to first Mark Smolinski and then John Nkangasong. And first panel will be Mark, and he is the president of Ending Pandemics. Since 2009, Mark served as the Chief Medical Officer and Director of Global Health at the Skoll Global Threats Fund, and there he developed the Ending Pandemics in Our Lifetime initiative in 2012, which then is spun off as its own independent entity. And then he also developed the Predict and Prevent initiative at google.org previously. He's going to lead the first panel. The second panel, as I mentioned, will be led by John Nkangasong, and he is the first director of the Africa Cdc, and was actually previously the deputy principal director of the Center for Global Health at the US CDC, and the associate director of laboratory science and chief of the international laboratory branch at the Division of Global HIV/AIDS and TB. And so he's also been appointed as one of the WHO Director General Special Envoys on COVID-19 preparedness and response. So at this point, I'm going to turn it over to Mark, who's going to lead the first panel. Thank you, Mark.
Great. Thank you, Eva. It's a pleasure to be here. And thank you to everybody who's joining us, whether it's your morning, afternoon, or evening, for this panel discussion on One Health in Practice. So we have a very diverse panel of experts that cover human, animal, food safety, and environmental health. So we're going to forego formal presentations and instead have a discussion with our 5 panelists in a Q&A format for the first 30 minutes facilitated by myself. And then the second 30 minutes will be open to all of you in cyberspace to send in questions for any or all of the panelists. So to kick off this session, let me just share with you 80 seconds of a very timely video from John Oliver's HBO show Last Week Tonight, which aired on Valentine's Day. So we're going to talk about some of those ideas that can make a difference around the globe. And so with that, I would like to first turn this over to Ezron, because Ezron has taken the process that was actually shown there in Thailand as an example of One Health surveillance, and was part of that development of that process, which we funded in Thailand because we knew we wanted to replicate it in Tanzania. And that's the project that Ezron has been leading. So with that, I would like to give an opportunity for Ezron to talk about the community-based approach for One Health that you've developed there, called AFIA Data, and give the group an understanding of how the tool works, who's using it, and what you're learning so far.
Thank you very much. Thank you for organizers and extending this invitation to me, and especially to the SACID Foundation for One Health, which is the organization I work with based at Sokoine University of Agriculture. My name is Ezron Karimbribo. So actually, our system right from the start had to adopt a strategy of being focused to the community. And therefore, during the designing process, we invited both official, human, animal, together with community to identify challenges facing surveillance. And therefore, through the challenge, we designed the solution. The solution we are referring to is this the technology supported, this is what we call the AFIA data, but plus participatory disease surveillance at community level under One Health approach. In this way, actually, because we are focused to the community, what matters most is to understand our local environment, because most of the community guys do use local languages. So our AFIA data, which is actually a brand name for AFIA in Swahili called health, and the data is data, is taking into consideration the application of multilingual, so that actually everybody can feel comfortably to identify and report, events based on a language which is understood by him or her. But at the same time, the system is used primarily by community health workers who are staying within the community, and one person can be able to detect events both in human and animals. And this is actually
I think we've lost Ezran.
We will try to get him back. Can we move on to the next?
Okay, sure.
panel?
Sorry about that technical difficulty. We'll come back to Ezran. So let me just move on to James. So maybe Ezran can hurt, but so James, what Ezran was talking about in looking at the various communities and engaging with them, dealing with the issues that are important to them, we know that some of the areas that they've been working in include geographical areas that have suffered from human destruction of nature, including deforestation and other ecosystem disturbances. And I was wondering if you could share your perspective of the impact of these changes on the emergence of new diseases.
Thank you, Mark. Well, I think most folks in the community of One Health would be aware that most of the pandemics that have emerged in the last 20, 30 years, 30, 40 years, have actually emerged out of forests and wetlands that have been encroached upon by people from logging, agriculture, legal and illegal activities. And that relentless pressure and displacement of animals getting into their habitats is at the root of a lot of the pandemic problems that we face, and part of a bigger canvas of the changing climate and changing environment and degradation of the environment. So I think that really has a great potential for the One Health initiative to gain a lot of traction by linking to the broader climate consciousness that's growing in governments, among people, in businesses, and so on. Deforestation, this was the Indiana Jones actor. He's very keen on this. He has a strong video, Harrison Ford, where he gets very passionate about stopping the destruction of nature and pointed out something that I didn't know, which was that the destruction of nature and wetlands basically adds as much CO2 as all the trucks and cars of the world combined. Quite apart from the biodiversity loss, irreplaceable, the pandemics that you spawn, it is pumping in CO2 into the atmosphere, which in turn worsens the conditions for pandemics. So you put your finger on a key aspect, I think, there. If we can stop and slow the destruction of forests, if we can put areas of forests that are being destroyed under better surveillance, working with things like planet.com, that's got a forest surveillance system, satellite-based, and couple that with underground syndromic data from pharmacies, from health centers, we've got an earlier warning system for the pandemic, not just waiting for the first case, but looking at the confluence of circumstances that makes for these epidemics. So thanks for that.
Excellent, thank you. And so while we're talking about the environment, we know that plants are an important part of the environment. So I'm going to turn it over to David Rizzo, because we know in the One Health that the plants get short shrifted from every discussion that we have. We're lucky if we get environment in there with human and animal discussion, but certainly we don't hear enough about plants. So tell us why we should all care about plant pathogens.
Well, I mean, not just plant pathogens, but plant health in general. And you're right, plant sometimes get shunted off to the side in One Health. But I think there's a number of broad reasons why it's really important. We could talk about food security and food availability. So plant pathogens causing destruction of yield, killing plants. We could also lump insects and other biotic agents and abiotic agents in there. So plant health from that point, food availability. There's also the issue of food safety. And this is one that I think has gotten the most interactions with One Health. So these are often human pathogens or organisms that make toxins that directly impact people, such as mycotoxins. So there's been a lot of work in that area of food safety linking with animals, both domesticated and wild animals, that will potentially contaminate vegetable crops with, say, E. coli, salmonella, et cetera. We can also look at the economics of plant diseases. And there are a number of crops, for example, early morning here in California, coffee, that's not necessarily a staple crop, but it provides livelihoods for millions of people in low-income countries, and an emergence of a disease, coffee rust, for example, in Central America, has had a huge impact on the health of people indirectly by destroying their crops. And then James just talked about deforestation, and there are many pathogens in forest, insects in forest. Most of these have been moved around the world, and we see destruction of forest that way, not just from cutting down forest, but also through the introduction of exotic insects, exotic pathogens. So all of those tied together show plant health is really important. And kind of going back to my first point, when we look at food, probably the vast majority of the food we get comes originally from plants, either directly or indirectly through feed for animals. So I think plant health can be a really important part. And I think plant pathologists, plant health people can work with other folks, and it's a two-way street there. So I think it's really important.
Great, thank you. So while you mentioned food safety, so now we'll turn this over to the other David, to really help us understand how foodborne illnesses are often a One Health problem, but yet we don't often include them in a One Health approach. We take very siloed issues for foodborne illnesses. So I'm wondering if you can share some of your ideas about how we can be broader in our thinking about foodborne illnesses.
Sure, thank you, Mark. And let me first say that my views here and some of what I'll say have been shaped by many years at the USDA Food Safety and Inspection Service, and more recently at the U.S. Food and Drug Administration, where I've been focused on foodborne illness for nearly 20 years now. I think that I'll pick up a little bit on what David Rizzo just said. This interplay of animals, the environment, and human health has been evident to us, even though we haven't thought of it in the One Health context for many years. In fact, I would go back and say that the initiation of PulseNet in the mid-90s by the CDC and many other partners is an example where we were able to compare the genetic elements, unique genetic characteristics of food samples and the environmental samples and human clinical isolates. And by making those comparisons, make those links between foodborne illness and the exposure that has caused that illness. Now it's been supplanted by whole genome sequencing, which is just the newest tool we have available to us to compare the genetic characteristics of the food, the environment, whether that's the natural environment or the manufacturing environment, the food manufacturing environment, and human illness. And it has become a very powerful surveillance tool. I'll just say that the National Center for Bioinformation at the NIH has a catalog of over 500,000 pathogens currently, bacterial pathogens, which represent the possibility of connections between human illness and environmental or animal pathogens. And so this has provided us the opportunity on a daily basis. We've got federal officials looking on a daily basis to do these comparisons, to look for a link that may indicate a connection that, of course, needs to be confirmed by epidemiology and some of that good old-fashioned shoe leather epidemiology, but also may be the beginnings of an outbreak that we can get an early jump on and provide a quick resolution and therefore prevent secondary cases. So this interplay of humans and food animals or wild animals, as David mentioned a minute ago, and the environment in which they live, together with, in this particular instance, crops, produce, for example, is a really interesting area for us to continue to explore, and has focused us on, particularly on the importance of the environment, our understanding of the ecology in which these pathogens may live and thrive, and therefore be available to cause infections in humans. So that's just a bit about what we're doing and what we've been focused on for many years. And you'll hear more about whole genome sequencing tomorrow from one of my colleagues at FDA, but that's just a little bit about that. Thank you.
Great, thank you very much. So Carrie, in looking at One Health approach, your group at Sandia National Laboratories has really been instrumental in developing simulation exercises, or often referred to as tabletop exercises. Can you share with the group some of the work that you've been doing to really use that methodology to really improve One Health, whether within an individual country, or I know you've also used it to even help build some regional collaboration?
Absolutely, Mark. So, exercises, you mentioned tabletop exercises, simulations are tools that emergency management's used for a long time to think ahead. How can we be ready? How can we look at how to be ready for different outbreaks, different emergencies? But when you really think about how to assess One Health readiness and to get everybody together, we've talked about plant health today, ecosystem health, animal health, public health. These are all siloed fields, right, with siloed information. And so to test that, you really have to develop simulations that mimic what's happening in real life so that we can figure out how to break down those information silos that can be really damaging and detrimental for early detection or effective response later. So we developed these role-based exercises that are multiplayer, and they're with a participant-led analysis. And so everybody's playing their own world like they normally would. So, for example, the one you just mentioned, the one we've done with y'all with the South Asia One Health participants involved about, I think, 7 to 8 countries, 13 different scenarios. So you have epidemiologists in public health addressing the public health data and case definition, line lists. You have laboratorians dealing with the challenges they deal with every day in terms of, freezer space or types of samples coming in. And in that instance, how do you detect an emerging coronavirus? Actually was the outbreak we did in 2015 with y'all. And so everybody gets that information they would normally get, because in real life, the public health sector is not going to be privy immediately to what's happening in the animal health sector, let alone out as what Ezran was talking about, what's happening at the farm level. And so if we can start to test those systems through a simulation, we can start to identify where the information is being shared, where coordination is taking place, and where maybe we want it could be improved. So with the example from South Asia, the countries participated in this exercise of this novel coronavirus outbreak, where we looked at not only the cross-sector collaboration between animal health and public health, but also that cross-border collaboration among all the countries. And what came out of it is participants identified, what would really make a difference here is a South Asia One Health disease surveillance network to provide that element of information sharing. And so since then, we've conducted remote and in-person tabletops following up on this, where we've used simulations to inform other aspects of developing that network, like disease prioritization. We've used the same approach at a country level with, we have countries where we've actually trained this methodology. We have a software called PrEP. It's a free online software that allows for running and tracking all the information when you have that many scenarios happening. And in this country, I'm thinking about we call them our biothreat readiness leaders who've learned the strategy, have used tabletop exercise simulations with this approach to test their national level One Health strategy, as well as an operational level, their disease response plans to things like Rift Valley fever and brucellosis. So I think simulations provide a couple great opportunities. One is to build those relationships in advance, because that's critical. Second is to really appreciate the strengths of the other sector and to understand the challenges they're facing, and also to kind of make those specific plans on how to move forward.
Thank you, Carrie. We're going to go back to Ezran, who I think is only going to join us without the video because of the unstable internet. So he can, I'm going to go back to Ezran if you want to share some more about the AFIA data tool. And then building on what Carrie was talking about, the One Health, I know you're also working to even think about how bringing that data from the community together with official data, both human and animal, and looking at a One Health surveillance system. So back to you, Ezran, you have the floor, and please share what you would like with the group.
Thank you very much. I hope you can see what I've shared. The AFIA data tool actually is an app with 2 components. We have web and mobile app. But what we envisage as our vision is to have events actually early captured at the community level, so that they can help to inform the national and consequently the global level. And what we are actually proposing now as a vision is to have like unified and verified signals shared by different ministries responsible for health, livestock, wildlife, and environment, so that they can see what is happening even before the response it happens. But thanks to the support we had also as a country in Tanzania from USAID, we managed to establish the One Health Coordination Desk under Prime Minister's office, which happens now to have a department responsible for disaster management. So when it comes to managing the One Health related disease outbreak, it is easy to mobilize the resources, both human and finance, and as well as support in stuff like verification and also diagnosis. So this is what we have, and we with our experience from the past in one district of Tanzania called the Ulanga, we managed actually with the deployment of this Afya data platform and the use of participatory surveillance using community level One Health reporters. We managed to pick the early actually cases of like an unusual event, sudden rise of dog bites, which prompted rapid actually response from the officials, and therefore confirmed to be rabies, and consequently actually it was easy to mobilize resources from different stakeholders, and massive dog vaccination plus awareness creation was actually instituted immediately, contributing to immediate actually containment of the event. So this is our vision from community to the global level, focusing on event-based surveillance linked to the official system. Over from me.
Great, thank you, Ezra. If I could just ask you a follow-up question that I think the group would be interested to know. I know one of the groups that you work with in Tanzania is the Maasai community, because they raise their livestock in very close proximity to the wildlife of some of the nature preserves and parks there. And I know that that was an intentional community to work with, thinking that spillover could happen first from the wildlife into those domesticated animals with that community. And I'm wondering if you can share, since you've been working with that community for a while, has it led to different changes of behavior in the Maasai community, or things that have really resulted because they've been engaged in this direct community tool?
Yes, absolutely. Yes, thank you. The first thing was to engage the Maasai community during the design of our system. Therefore, when we approached them for the first time, that time we asked, what is your problem? They did never mention disease as a problem. Rather, they said water is a convergency actually point where it can be a source of transmission of diseases between human, wildlife, and the animals. And this ecosystem unique, which is a World Heritage Site called Ngorongoro ecosystem, is actually cohabited by both human, animal, domestic, and wild animals. And therefore, by actually involving them in designing, we came up with a clear actually configuration of supporting the system, supporting either the human diseases, animal diseases, or zoonotic. And even if you want the vertical system, that could be easily done. And now with our presence in that ecosystem for about 10 years, we have now seen some change of practice with respect to actually to their community health reporters. And we have some examples of impetigo like event happening, school children, which immediately was responded to. But also we have issues related to some primates, abnormal behavior primate eating human beings. We managed to identify and link it to the wildlife department for further investigation and containment. Thank you.
Thank you, Ezra. So I know our panel has about 5 more minutes before we're opening up to Q&A. So let's quickly go around with one more round of questions, but please keep your answers to less than a minute. And then I'm sure we'll have lots of questions from the audience. So going back to James, I'm just wondering if you have some ideas about how we could better integrate environmental surveillance into public health. Are there some new approaches or some new partnerships that we could be thinking about to really make that happen?
Great question, Mark, and a perennial one, how to integrate environmental surveillance. I remember working in Michigan as an EIS officer And I was amazed at the divisions between health, agriculture, and FDA in investigating a simple salmonella outbreak due to eggs. It was in a place called Isabella, so Shigella in Isabella. But as Carrie mentioned earlier, there is this tendency to compartmentalization. Some things in some countries actually have been they're internalized. So example, right now in Trinidad and Tobago, the ministry issued a note that lots of monkeys have been found dead in the southern forests of the island. And pretty much everybody knows if they haven't died from lead poisoning, that's presumptive evidence of yellow fever in New World monkeys dead in the forest. So you have an early warning system for the risk of yellow fever. You can step up your vaccination campaigns and so on. That's a well lubricated one by decades of exposure to these sorts of things. I think there are a lot of innovative possibilities with digital health, and each citizen, each health worker, each environmental carrying a mobile phone that can do measurements in ways that, imagine if we turned our webcams out a little bit, what we might see from all the health centers. I think so. We have this scope for, especially with digital health partnership, strengthening this kind of integration. And people are much more interested now, I think, in environment than they used to be.
Yeah, thank you. So going back to David Rizzo, I remember in our prep for this panel, you had made a comment that stuck in my head, and so I'm going to throw it back to you to see if you want to share it with the group. But you talked about how plants could actually serve as a model system to advance our knowledge or methods that are directly applicable to human health. And that was very intriguing to me, and I wonder if you could expand on that idea and share with us how we might be broader in our thinking about using plants for that purpose.
Yeah, I mean, I think, so many of the processes with disease that occur in people and animals do occur in plants. There's clearly a number of differences, but I think concepts of, for example, surveillance, particularly aerial pathogens, have been done with plant pathogens for a long time. And so ideas from there can be applied to human and animal systems as well. So I think there's a number of different things, all the way down to ideas of innate immunity. I mean, basic research to applied research, I think, can all be tied in there. And, from the basic research things, I mean, obviously there are certain ethical things that you could do with plants that you can't do with people and animals. The other part that I think, is really interesting here is, as a plant pathologist, we've always worked in populations and communities. An individual wheat plant is not worth a lot. So there's been a long effort in modeling, particularly in epidemiology, looking at communities, looking at populations.
Great, thank you. David, the other David, you mentioned that maybe tomorrow someone's going to talk about whole genome sequencing, but we know that whole genome sequencing has really revolutionized disease surveillance. And I'm wondering if you could just share some perspective from your angle about how this application can really help us advance One Health in general.
Yeah, thanks, Mark. I'll just maybe echo some of what I said earlier, and that is that whole genome sequencing provides the opportunity for us to make connections, at least at the molecular level, the genetic level, that then need to be verified through more traditional epidemiological activities to make the connection between what appears to be a connection on the genetic level with the actual exposure that has caused an illness. So there is this combination of activities that are very important to continue to advance foodborne illness. But the power of whole genome sequencing, I just want to repeat, is the fact that we can see these connections in real time. And as I said earlier, on a daily basis, we've got federal officials and state officials, for that matter, looking at this huge database and looking for those connections, which can give us an early warning as to, something that might develop into a large outbreak, and try to get at it early.
Great, thank you. And Carrie, I'm going to come back to you and combine a question that we had for you from the panel, but also a question from the audience that is related to this. So can you speak a little about how you're using the process that you talked about to really, during COVID, I know you've been doing during action reviews to really lead through a process that could help, in a second wave by learning from the first wave. And if you could just talk a little bit about that. And then someone from the audience wants to know if VR training has ever been part of this kind of activity as well.
Absolutely. So for the first piece, for COVID, we developed this during action review approach, because after exercises, after outbreaks, usually, ideally, everybody sits around and does an after action of what's working, what's not working, what can we do better next time. And ideally, that ends up in changes in plans and training and resources. We're in the middle of an outbreak. It's a really tricky time to sit down and to have that kind of reflection, but it's critical. But what we've added to it is this simulation approach of not just doing a retrospective, but a prospective. How can we use future scenarios to figure out what are, in working with communities and countries on what they're most concerned about? And so in the initial stage, we asked those questions. We designed tabletops using this approach we talked about a minute ago, that look at those different future scenarios, 6 months out, a year out, 3 years out. And what do we want to know now that could best prepare us for those situations later? And from a One Health perspective, we've incorporated a One Health perspective because this is a One Health outbreak. What we've seen is some awesome strengths that can be utilized, and that when we're most in need of surge capacity, thinking creatively. Animal health and plant health have laboratories with PCR capabilities. Animal health workers in communities are trusted and can play an important role in risk communication in the field. You've got epi, like David just talked about. We've got plant animal health. Epi's epi, right? And so you have all these different capabilities, from logistics to emergency management to epi and lab, that can be leveraged across the different sectors. And we're seeing that happening. And I think we have an opportunity to figure out how to sustain that, and how to institutionalize, develop policies to strengthen this so that we really can improve resource sharing and surge capacity. We've also seen, unfortunately, that the challenges that happen and when animal health workers don't have the PPE they need to keep themselves safe because it's being used in a public health outbreak. What can we do to plan 6 months, a year, 2 years out to stockpile, to do mitigation strategies on where we can get university supplies or supplies from schools to help mitigate those types of challenges that are faced? And so I think those scenarios provide that really unique chance to look ahead. We can't ever figure out what the worst case scenario is going to be, but we sure can try to mitigate as best we can. In terms of the VR question, we've been talking about exercises at what we call a strategic and operational level, the policy level, how everybody's working together and coordinating. We have developed some video game based trainings. I won't say it's not VR. We have looked into VR, AR, and you certainly can do it. But in order to do things like carcass disposal and waste management, to do the tactical level trainings, because we really need to improve a lot of the communities, either they're under-resourced, they can't send people to trainings all the time. Here in the US, we may have states with, limited amount of staff in their departments responding to One Health emergencies, animal health emergencies. So if we can develop these kind of video game modules to help improve the tactical level response at a local level, it's really helpful. In terms of AR, VR, what we found in the platform we did develop, the PrEP platform, and in these video games, is it's important to keep them very simple, low bandwidth. We're all living in this Zoom world right now, and we all see video cut out, everything cut out. So I would say that, are there opportunities? Yes, I think there's some cool applications in a biosafety, biosecurity space and laboratories, et cetera. But I also think that in some of the university folks may have other examples from teaching in human and clinical and animal health for VR, AR. But I think there's just this need right now to get that information in the field for just the basic response levels. And you can do that without having to go to that level technology, though obviously it would be probably fun for some folks. So.
Great, thank you. Well, the questions are pouring in, so I'm going to try to combine a couple of them together. So this question is for Ezra, and I think also James, you may want to weigh in on this one. Your comments earlier, James, about the land use changes and so forth, and the question specifically for Ezra is are any of your community-based tools or what you're doing in your One Health approach actually helping look at conserving high ecological integrity? And I'm thinking maybe, James, you may also want to weigh in if you have ideas about how we could do better engagement and consider conserving these high ecological integrities rather than just assuming they're happening and then worrying about the outcome. So maybe first to Ezran, if you have anything to share about how your tools are helping think about conservation of land or other ecological issues. Over.
Thank you, Mark. Actually, to be true, actually, we are not working under the coastal ecosystems, but the concept of the AFIA data usually is all embracing for any scenario. When we deployed our system in some of our 12 districts in Tanzania, there were some emerging issues like environmental health, which we immediately supported users. So if, for example, there is an existing framework and tools, we could easily digitize that for help to collect information and link them to responders, but potentially it has that ability. Thank you.
Great, thank you. And James, before you answer, another question came in that is also related to this. As you talk about any ideas you have, someone also is wondering, what are some of the understudied environmental variables? You know, we all talk about deforestation, but you know, what are some of the other ones that maybe aren't front of mind that we should think of? Over.
Thanks. So there's sort of two questions there. One is about ideas around land use, and the other is understudied questions. I think right here in the Caribbean, I would offer an example where they looked at a integrated coastal and aquaterrestrial solution, beginning from a ridge to reef. And that was supported by Germany, and a lot of the small islands had significant advances with that and improving marine protected areas, working with farmers, more sustainable use of pesticides and drainage and so on. So that's a local example. I think forests and wetlands are being destroyed at such a rate. What can we do, and how can we improve surveillance, not only for emergent problems, but how, by putting things under scrutiny, we help to hold governments and corporations to account. And I don't have a full answer to that, but if we can find a way to better gather publicly available data from satellite imagery, high resolution drone imagery, and drone pilots associations. There's all sorts of, here in Trinidad, we've made a deal with the Drone Pilots Association, and they're helping with the continuous surveillance of bushfires when they emerge to facilitate rapid detection and response. So there may be some new partnerships there. And if we put some of the areas under destruction in the Amazon and in Africa and Asia under more public scrutiny and talk about it, make news about it, it serves a notice to those who are destroying, as well as providing additional information for action.
Great, thank you. Okay, a couple of really intriguing questions here. We'll just throw these out for the group. One is something we haven't talked about. Could you comment on the One Health forces at play when thinking about the interaction between communities reliant on local seafood and the related coastal ecosystems? We did leave out fish in our conversation, but I don't want to put anybody on the spot, but if anybody has any comments to that, that was a question to the group. Over.
Yeah, and I didn't answer your earlier question. If I could jump back in about, what's understudied.
My apologies.
It's okay, because I think it connects to this question as well. And I think what's understudied is complexity. What's understudied and what we don't appreciate is how things fit together and the implications of Sahara dust at the levels we have it, transporting aspergillus spores, harming potentially coral reefs and other things. We don't understand what's happening with sargassum weed, that you now have weed contiguous from West Africa to the Western Atlantic. There are things happening that some of those things are understudied, and because they're unprecedented and at such a scale, we're duty bound to study them more and because they're connected. And then the other is complexity. We're good in our reductionist science, but we're not as good at seeing how things are really interconnected.
Right.
And Mark, I was just going to add to that, kind of the systems approach in any food system is so critical, because you need to not just you're looking at all those factors he just mentioned, but then in addition, what are all those downstream impacts to a community? So not only the immediate impacts of the immediate food security issues, but what does that mean to the health of those communities? What food sources are they going to use instead? What risks does that present? And really looking at that upstream, downstream approach as a systems analysis, I think is critical for any food systems.
Right. Well, here's a question for David Goldman, but maybe others will want to weigh on it as well. National defense is often assigned a large portion of a nation's budget. If funding and government buy-in, quote unquote, might increase linking the One Health mission to national security, how might military branches of a country's government partner with One Health? Examples, program deployment, data sharing, etc. So you don't have to answer that in any official capacity, but others may have ideas as well. But this does come up quite often. You know, if those are big budgeted areas, how do we partner more with defense than complaining that they're getting the bigger portion of the pie? Over.
So, Mark, I'll start with an answer, and it won't probably address the entire question, which is an interesting one. I'll agree. I will say that in using food safety as the perspective again here, that the DoD has been a partner all along the way. And I'll just mention one example. We have a advisory committee called the National Advisory Committee on Microbiological Criteria for Foods. DoD has been a partner in that for its existence for a couple of decades now. And so that committee contributes to the knowledge of particular foodborne pathogens, and to the extent that foodborne disease is a national security issue, acknowledging it's not transmitted in the same way that some of the viral respiratory pathogens are, then the DoD has been right in there helping with our understanding of that. And I would say, I don't know this for a fact, but I believe they contribute isolate sequences to the National Center for Biotechnology Information at the NIH. So they contributed that data in that way, and it helps us, as I said earlier, to understand the connections between foodborne pathogens, exposures, and human illness.
Great, thanks. Okay, we have a question for David Rizzo. Much of the world uses plant-based medicines, some of which are shown to be effective and some are not. But use of these medicines is culturally determined and will likely not be replaced by more expensive drugs. So what role can One Health play in trying to understand this widespread use of plant-based medicines? Over.
Oh, well, I'm certainly not an expert in that field. I'm sure there are people watching this that are more of an expert, but I think, not just plant-based, but, I'm thinking traditional medicines, including fungal-based. I mean, there's a lot of cultures that have traditionally used mushrooms, for example, for medicines. And to me, from the One Health standpoint, I mean, it's made for One Health is for people to go in with an open mind. I mean, it's a two-way street. And this is where collaborating with anthropologists, sociologists, as well as getting people with more traditional Western medicine to keep an open mind on what these traditional medicines can do. And obviously there are many, many important medicines that have come from plants going back centuries. So I think the key is just that two-way dialogue. But I also want to mention, James mentioned something in one of his last answers when he mentioned the term aspergillus infecting coral reefs. And another part of plant health is the use of pesticides, which allows many plants to be grown. But the same issues around AMR also work with plants, and particularly with fungal diseases. There's evidence that overuse of fungicides can spill over to fungal diseases of humans, and many fungal diseases are important with people with compromised immune systems. So again, all of these require people talking to each other, and I think that's where One Health comes in.
Great, thank you.
Can I also contribute? Can I also contribute to this question? Thank you. I want to share experience in Tanzania. Actually, we have a long time experience working with the pastoral community who value much the lives of the animals more than themselves. So the human beings usually tend to go for traditional medicine, but they buy these modern commercial veterinary products. And to us, under one hand, that is a good entry point, because when there is a thing like massive vaccination for animals, then you could use it as an entry point for addressing the human health issues, like awareness creation, even quick screening of health issues in human.
Great. And Ezra, while you have the microphone, there was a question for you and for the group in general. But in your community-based approach, Ezra, how are you dealing with potential rumors that might come through a system? And is your system at all integrated or collaborating with systems such as ProMed Mail or Epicor? For those of you who don't know what Epicor is a crowd-based epidemiology community that volunteers to verify any signal that comes through an automated disease surveillance system in a completely voluntary basis with, I think there's 145 countries and over 2,500 experts in human, animal, and plant health. So Ezra, can you talk about how your systems integrates with those systems and how you potentially reduce any rumors coming out from these? Over.
Thank you. Our system has a specific module which is called Affair Watch, and this one actually tries to do crowd verification of reported events using community members and the local. When I say really local, is not at the subnational level, at the community level, who could actually verify some of the reported events. And usually these people who are involved in verification, they are given like a credibility score. If, for example, you consistently report, correctly event 10 times, then your credibility goes high. And therefore, this initial verification is linked to official verification, therefore minimizing the number of events to be actually verified by specific, sector or ministry, health and livestock and environment. But also, when I projected my framework we're using, yes, we are also linking our systems to the global scanning ports, including the ProMed and also the Epicor. What we faced actually while we were designing our system is for initial verification local, because it's linked to the local, then there's some issues our ministry thinks are sensitive. So we want to link our system to the global scanning system so that they become part of another module called data science management, where we can now use advanced actually analytical approach like artificial intelligence modeling for prediction and intervention to inform our system. Thanks.
Great, thank you. So here's a question for the group that I see David Goldman has already volunteered to have a comment on, but it seems everybody may have something to say regarding this. How can the private sector be engaged more in the One Health Challenge, considering they're often the most crucial actors in creating and perpetuating environmental health problems? For example, the food, meat, logging, construction, agriculture, so forth. So since you volunteered, I'll turn it over to you, David, first, but others may want to comment on this because involving the private sector comes up over and over.
Sure. Thank you, Mark. Just wanted to comment again from the foodborne illness perspective. You mentioned at the outset that foodborne disease can be framed as a One Health issue or One Health problem. I think it also requires a One Health solution. And that by that, I mean, if you look at land use in and around produce growing fields, for example, the adjacent land use has come to our attention as a very important element in understanding how contamination of that produce happened in the first place. It requires that we bring together private entities, produce growers, farmers and ranchers who raise cattle on adjacent lands, perhaps even others from a state authority who understand wildlife patterns, as an example. So it requires multiple entities, both at the government level and at the private level, to really get at a solution that is workable for all parties.
Great. Any other comments from the panel on private
Yeah,
sector engagement?
I'll just briefly comment that I think that not just in terms, they're critical for every stage. They're the ones who are doing the very first detection. If we're looking at livestock industries and other industries, they've played critical roles in response along the way. If we've seen through logistics and equipment and supplies needed for these responses, and so they're a partner that we encourage people to include in the types of exercises we've talked about. And when we've done assessments here in the United States, we've seen that this is a group that needs further integration from both for a trust perspective, to build those trusts so that they can partner better when things are happening, or for preparedness in the beginning.
Great. James.
Yeah, I just want to loop back to another one that's sometimes awkward, which is the cooperating with the security system and military. And quickly, I think right here in the Caribbean, there's a history of civilian military cooperation that goes back, and it's kind of forced by these mega hurricanes. When it knocks everybody down, then everybody gets together. So we have a long history of that. But you find in Central America, there's a lot of tension between the military and civilian systems. So having them to cooperate on anything, including epidemic detection and response, could be tricky. In the region of the Caribbean, the federal agencies, the public health agency, the security agency, the aviation security, and so on, have been mandated, and the SEDIMA, like FEMA, has been mandated by the presidents to work together. And the European Union funded some actual exercises, like was mentioned, and simulations for how they could work better together in response to different kinds of public health emergencies. So, and then the last one within the US system, I participated in a task force to look at the US global emerging infectious surveillance system overseas. Bit dated now because we reported just before 9/11. But at the time, there were several military labs overseas in Cairo, in Kenya, San Diego, in Asia, that all tap into veterinary and animal sources as well. So to me, they're part of the network that the military have. A lot more perhaps can be done, especially with satellite imagery and other sorts of joining together of environmental data with health data. Over.
Great. Well, we have 1 minute, and there's one question that I do want to read because I think it's an important message, whether we have time to really respond to it or not. But what role might natural history collections and other biological collection managers play in One Health systems? Such collections have helped solve a lot of emergent pathogen problems in the past. How can we improve the natural collection infrastructure in the global South? And I just want to take this opportunity to point out the One Health outbreak exhibit at the Smithsonian Museum of Natural History that looks at epidemics in an emerging interconnected world. And I certainly learned a lot from working with the Smithsonian on that project, how much value and research comes out of the Smithsonian from their natural history collection. So if anybody has a quick comment on that, please. Otherwise, I think it's just important to get that message out there. It was a very, very important question.
I just was going to share, there's been a Project ECHO series this year looking at that and the role that natural history museums can play in terms of emerging detection, disease pathogen detection.
Great. Well, with that, I want to thank our panel. This was a really exciting conversation early in the morning for some of us and late in the evening for others. But again, thank you for your time. Thank you for all the great questions from the audience. I'm sorry we couldn't get to the rest, but I want to be respectful for our next panel and turn this over to John Nicholson, who is the director of the Africa CDC, for what I'm sure will be an equally interesting conversation. So thank you again to all these panelists, and we look forward to the rest of the day.